First of all, it may be of some interest for you to know I'm not a medical doctor, but a health economist. I'm a trained health economist. So just to avoid misunderstandings that may occur during our talk. Second is I would like to introduce you to my colleague, Christian Weber, who is an expert in AI, and he comes from medical data science. So just in case your question are referring to AI in special, I'm glad to have him on board. Before we start, you may know that at universities, and that's the institution I come from in Siegen, we are better in asking questions than to give answers. And my first question to you would be, who is a general practitioner in here? Or do we have general practitioners in here? Okay, 1, 2 more. Okay. The reason why I'm asking is that it's always interesting to have the special perspectives of general practitioners when it comes to data monitoring in a group of patients. Because the first question is, what is the data outcome for? What can we use it for? And if the medical doctors aren't convinced that this makes sense for their therapy in the end, there is no need to start it. And how to overcome this is one of the core questions we have. Who has been taking part in the plenary session this morning? Give me a hand. Okay, we have had 3 talks, one by Tuomo, you already have come to learn him, and he told us about procedures. He told us about that procedures alone are not effective enough to overwind routines we find in general healthcare. So there must be something else. Second is, we need to learn more about the habits and the mindset of our patients. How do they deal with the digital question? And third, and I think Rob, and Suzanne's, that was one of your points. Coming from a hospital, we have different procedures than we see them in rural areas at the places of general practitioners in their practices. And does this make a difference? And I think, yes, it does. And are processes scalable? Means how many practitioners do we find who want to make a difference in their daily routines? And they have to come to learn about and with each other. Now, to give it a start, vital data as a prescription means here, first of all, empowering patients. That means they take their own data they are monitoring, but also we are in need to give them the opportunity to find out what their data means to them. So they have to understand it. And if they don't understand it, and if they don't see the necessity to monitor them, they will not do it for a longer time. They will do it for a short time during the time they are asked for it to do so. So this is important because we believe that we have to enable proactive care. This is a consequence in Germany and maybe partly in Europe that our healthcare system is running out of power. It's not powerful enough. Not yet and not tomorrow. So what can we do? We all have to assist the system as patients. But what could be a good way to come to a good solution? Okay. Yeah, give it a try. Oh yeah, thanks. So what we started with is, well, you could call it a real lab, a reality lab. And this reality lab is situated where the University of Siegen is, localized, and it's in the heart of 3 states in Germany, which are North Rhine-Westphalia, Rhineland-Palatine, and Hesse. And in this area, we have the problem that the amount of general practitioners, especially, is shrinking dramatically because of age. Mainly because of age. So this is one reason why we thought it would be a good idea to set up a cross-sectoral and interprofessional healthcare project in these rural areas. And we have been communicating and projecting with round about 70 general practitioners. And we have been testing and evaluating digital solutions in cooperations not only with physicians but also with facilities of care facilities for the elderly. So what we try to find out is what self-care and prevention via vital data monitoring really is about. So our first goal is to learn more about how to prevent diseases. This is a game of time. Sometimes, if you have looked closely enough to a patient in terms of monitoring, you know what kind of diseases will come up next. You see it at a quite early point of in time. And this is what we want to make profit from. But that means that we have to deal with 3 levels of prevention. And the first level is the primary level, means maintaining health, where it is right now for quite a time. So reducing susceptibility to disease and increasing resilience in this context. The secondary level is the early detection of diseases, and that means in our context, patients have to support themselves by measuring and monitoring their own health. And the tertiary level is the prevention of relapses and worsening of medical conditions. So if this is going to work, our assumption is that we could take it a step further. And taking it a step further means to come to prediction. And prediction is where data comes in. And we not only have to use the rough data we find after having monitored a patient, but we have to deal with the data in terms of giving them more context, more health context, in the sense of prevention. So this is what we have been aiming at. And the concept of this monitoring vital data was to do it continuously in real time for prevention, diagnosis, therapy, and follow-up care. The measuring of the vital parameters with digital devices go by patients themselves at home or in a nursing home, where we also can include the support of the nursing staff or relatives at home. And you will see in on the following slides that this is really necessary to make the process work. Analyzing the data means analyzing data with medical AI. Medical AI in terms of gematic in Germany is not available till now. Today it's not available because well, the problem is not that we could not set it up technically. That's not the problem. The problem is to have it in use by accepted terms. That's the problem we are still suffering from in Germany. Maybe in the Netherlands you are already one step forward, but this is to me the big picture. And why do we need it? Analyzing the data, well, prevention we have already talked about, but also prevention means at any time you have to be able to make decisions. Every medical doctor has to be able to make reliable decisions. And what does this mean, reliable? Reliable means the decision has to be true. It has to be controlled. It has to be led back to the data. And this means we have all in all a shift from patient mobility to data mobility. This is what we believe after all these studies we have done. So how does monitoring of vital data takes place? How do we manage it? And first of all, there is a process. As always, one could say. I haven't heard a talk during the last couple of years on data health and monitoring, which did not came up at a certain point with the process. And the question behind the process is, can we make it work? And I think it was Rob who said this morning, don't waste your time on finding the ultimate process, but if you have got one you believe in, take the first step and then develop it further. Rob, is that right? Okay. So this is a try like this. And we started with a medical prescription of the vital data for monitoring by the general practitioners. They are prescribing the data their patients should measure on themselves by monitoring. And the monitoring of the vital data lies with the patients. And after that, we got the data and we want to analyze them by artificial intelligence methods, which means every person who is monitored in this room for some years, let's say for some years, we have big data. Big data is good for us in terms of AI because it's the foundation of every training of AI. On the other hand, we cannot handle big data we can only handle big data by machines. And that is the step to machine learning. and to know about the patterns. And we want to lead back the patterns to the possibilities of prevention at a very early stage. And now it comes to the point where the data, the AI worked data, comes back to the general practitioner. And he just wants to know what is the range of therapies I could get my patient into. And after that, he has to talk to his patients. And now the question again occurs, why should a patient follow the advice based on data of a general practitioner just in case he has monitored it by himself, but he doesn't understand, or she, what it's all about? So this means the future, as it seems to us, are patients who are scientific and data literate. Not so much scientific, but data literate, so that they can understand what their own measured data are telling them. So monitoring vital data is a testing of measurements for patients in nursing homes and at home of the patients. And we did this study in a little village called Burbach. Maybe some of you who were coming from the north to Frankfurt south passed Burbach and Haiger at the A45. So then you could have an idea where this all took place. And we have the technical development made during COVID. So in 2021, 2022, we developed the app and the web interface to project and to make the data visible. And the test phase with the patients at home and at nursing home took place under COVID. That made it difficult, but I will show you the results in a couple of minutes. So the pre-post survey of the patients, nursing staff, and doctors follow the following idea. The individual selection of the vital parameters and the measurement and the measurements of intervals were combined with the patient individual disease patterns, so that we can see here what kind of patterns have been regarded. In example A, a patient with heart failure and bronchial asthma have been measuring the blood pressure, the respiratory rate, the oxygen saturation, and the lung volume, also the body weight and the activity by sensors. And in example B, a patient diagnosed with intermittent heart arrhythmia and arterial hypertension and diabetes mellitus type 2 has been measuring the ECG heart rhythm, the heart rate, the blood pressure, and also the weight and the blood glucose. Okay, and at this point, it may be interesting to tell you that we are also busy in technical medical processes. And to us, it means a lot to think about how to make diabetes type 2 measurable by on-skin measurement possibilities. So what we need, and this is this is a scale of sensors. What we do need and what we are active in is to broaden up to the scale what possibilities to measure we have. And in Berlin, we actually have a company, a funded company, Diamond Tech, that's the name. They have succeeded in clinical studies to measure by an infrared spectrum, the blood glucose. Okay, so it's possible, but we have to be busy and broaden up the range of these measurements. So this, at that time, have been the devices we have been working with. And that means we took these measurements by using Bluetooth and to send the data into an app of an iPhone, and we bought 50 iPhones for 50 patients in order to make this happen. And from there, the data went into a cloud server, and that was the next trap and the next fallacy, because medical cloud servers have not been available in Germany at that time, except the Amazon cloud. So that means the data is stored somewhere in the United States and not in Germany. To make that remark means this is another topic we have to work on. So from there, the general practitioners have had the opportunity to get the data on their web interface in their practice. And that means the monitoring is not yet automized in a way that we have a red, green, or yellow light, but that's the term, that's the goal we want to receive. Christian, you wanted to say at this point something?
No, I showed 5 minutes.
Ah, you showed 5 minutes, okay. So this is the way we took the data. These are the numbers of the patients, 19 nursing home, 21 patients in their home. Measuring in the nursing home, as you can see, shows that we have a lack of constability. And this means every time under COVID, elderly people, and that means they are between 75 and 85, who have done these measurements, have been not able to do it by themselves, and this depended on their daily fitness, mental fitness and body fitness. And if we compare this with the measuring at home, we see that this is very, very more stable in measuring, and that means these people are between 55 and 70, and they give us a better performance. But what we can see out of it is that these web interface data are a core issue for the doctors to be better prepared when giving their patients hint for new therapies from a distance. The general practitioner is not able to leave his practice when it's filled up with patients to spend 2 hours to go to the nursery home. Okay, results from a doctor perspective. History of vital signs was useful. GPs could make a database decision, as I said, and doctor-patient discussions were more targeted because of data prevention. And the results from a patient's perspective, and this is, to me, especially something important, the adjustment of medications for 5 patients in a nursing home and 8 patients in a home-based on the evaluated vital sign data made a difference in their therapy. And the increased health awareness also led to a change of state of mind. What they did was they worked on their lifestyle. Okay, this is a book where we have written down the project outcomes, and what we believe is important for monitoring the vital data is to come, by including AI, to a concept of digital practice. And a digital practice is meant to be a hub. It's a telemedicine center in the rural area. And the hub function means many general practitioners are included to this hub. And the task of the hub is to analyze the data in a way that practitioners can use them very quickly. And in the next few steps, we want to make it interdisciplinary and intersectoral to include also hospitals in a medical data space by means of giving them the entrance for knowing all the data which is collected in that medical data space. So this is our belief in improvement of care, and the empowering of patients, as I said, is a core aspect in the whole procedure. Saying these, I'm ready to close, and as you can see, I have prepared for a discussion. Last not least, some aspects which are referring to vital data monitoring in the form of which forms of chronic diseases and comorbidities are to measure in the near future. Data medicine supports healthcare, and the technical affinity has to be proved in order to come to good results with the patients. Thank you very much.